If you look at the architectural blueprint of a large K-12 school building, or frankly, I mean, the organizational chart of any complex company, you see these incredibly neat, highly organized little boxes.
Right. Yeah.
You know, the principal goes here, the designated counselor sits in this specific office, the teachers are assigned to these specific
It
rooms.
all looks very clean on paper.
Exactly. Very clean. But today, our sources are revealing this massive, invisible, load-bearing structure that just does not exist on any official schematic. We are talking about the informal holders, the people who quietly, continuously absorb everyone else's trauma just to keep the building standing.
Yeah.
So, okay, let's unpack this, because our mission today is to examine a groundbreaking article aimed at school leadership. It's titled, "Who is Holding Your Holders?"
Such a great title.
It really is. And we're going to pair it with a real-world operational framework from down in Georgia called MentalSpace School, which is an organization that is actively trying to save these shadow structures from just complete collapse.
The timing of analyzing these two sources together couldn't be more critical,
Right.
because we naturally gravitate toward clean, visible systems. They give us this illusion of control.
Right.
But a shadow structure, this informal, completely unmapped network of emotional support within a community, that is what actually dictates the climate of an environment.
Absolutely. And I want to establish immediately why this matters to whoever's listening right now. Because whether you manage a high-stakes corporate office, or you run a busy restaurant, or you just, navigate the complex dynamics of your own extended family,
Yeah.
every single ecosystem on Earth relies on these informal holders. They are the people who constantly act as the emotional shock absorbers for everyone else's crises.
That's a really good way to put it.
Thanks. So today is about understanding the mechanics of what happens when those specific people begin to buckle under the weight, and the systemic, structural ways we can actually fix it.
Because the breakdown of these individuals is uniquely dangerous, because
yeah.
it doesn't happen with a loud crash. It happens silently. By the time leadership notices a dip in attendance, or a drop in performance, or even just a shift in the overall morale of the building, the emotional foundation of the environment is already deeply compromised.
It's too late.
Exactly.
So let's move straight into identifying exactly who these holders are inside a school setting, because our sources highlight a reality that completely upends how we usually think about student support. When a child is having the absolute worst day of their life, maybe they're dealing with severe neglect at home or an acute panic attack, the adult they gravitate toward is almost never the designated counselor sitting in that official box on the org chart.
No. And what's fascinating here is that students, especially those in acute distress, they do not consult a directory to find the appropriately titled professional.
Right. They don't look at the map.
They seek out safety. They seek out a proven track record of emotional availability. They navigate entirely by instinct, moving toward the adults who have consistently signaled that they are capable of holding space for complex emotions.
And the sources paint such a vivid picture of who these people actually are.
Yeah.
It's the teacher down the hall whose classroom just inherently feels like a sanctuary. Or it's the paraprofessional who has been walking the exact same hallway for like 11 years and has just become this immovable fixture of stability.
Yes.
Or, I love this example. It is the front office staffer answering the phones who somehow knows the first and last name, the custody situation, and the financial struggles of every single family in the district.
Oh, yeah, they know everything.
They hold the entire emotional map of the community in their head.
And our sources give a very specific clinical term for what these individuals are actually doing every single day. They are performing clinical adjacent work without clinical support.
Wow.
Yeah. That phrasing captures the danger perfectly, because they are performing the emotional triage of a psychiatric nurse and the de-escalation of a crisis counselor.
But they're doing it while simultaneously trying to, teach middle school math.
Exactly.
Yeah.
Or manage a chaotic lunchroom, or process late arrival slips.
So to go back to our blueprint idea, it's like these informal holders are the unseen structural load-bearing walls of the building.
Yeah.
They are entirely responsible for holding up the emotional climate of the school, and if you remove them, the ceiling caves in. But because they aren't technically designated as structural supports on the architect's plans, nobody in leadership is checking them for stress fractures.
And a load-bearing wall doesn't get weaker because it is defective. It gets weaker precisely because it is doing its job of holding weight over a prolonged period of time.
Right.
Absorbing other people's distress over a 180-day school year, has a highly quantifiable biological and psychological cost.
It's real wear and tear.
It is not free labor. The toll it takes is immense, and it accumulates in the nervous system.
Now, before we get into the symptoms of that accumulation, I have to challenge the core premise here just a bit.
Sure.
We are talking about teachers, paraprofessionals, administrators. These are highly educated, trained professionals. Shouldn't basic classroom management training and standard professional development already equip them to compartmentalize this kind of stress?
You'd think so.
Like, why are they breaking down from simply dealing with student misbehavior?
Well, that is a very common assumption,
Mhm.
but it fundamentally mischaracterizes the nature of the interactions. We aren't talking about standard misbehavior.
Okay.
It's not a student talking out of turn or forgetting their homework. We are talking about students in active crisis, carrying severe visceral trauma from their personal lives into the school building.
Right.
And the human nervous system is equipped with mirror neurons, which are designed to help us empathize by literally simulating the emotional state of the person in front of us.
Oh, wow.
Yeah. So when an educator spends 8 hours a day mirroring the dysregulation, the fear, and the grief of children in crisis, their own nervous system begins to fundamentally rewire itself to stay in a state of high alert.
So this goes way beyond just being burnt out or, tired of grading papers.
Way beyond.
I know the clinical term for this is secondary traumatic stress, or STS, and we usually hear about it in the context of ER doctors or first responders.
Yeah.
But how does secondary traumatic stress specifically manifest in the K-12 shadow structure, like a random Tuesday in November? What does it actually look like?
Well, burnout is a slow depletion of energy, usually tied to administrative frustration. Secondary traumatic stress, as outlined in our sources, is an active injury caused by proximity to trauma.
Okay.
It is emotional osmosis. You can picture the educator as a dry sponge.
Right.
They absorb the toxic water of a student's trauma to clean up the spill, but eventually the sponge reaches absolute saturation. And our text lists the specific symptoms, starting with profound emotional numbing.
Meaning their brain just throws the circuit breaker to protect them from feeling any more pain.
Precisely. When exposed to relentless emotional intensity, the brain artificially lowers its own threshold for feeling. So they stop experiencing joy in their personal lives, just as much as they stop feeling the sadness.
That's terrifying.
It is. The second symptom the sources identify is irritability that seems completely out of character.
Okay.
This isn't a grumpy employee. This is the famously patient, loving paraprofessional suddenly snapping over a jammed photocopier.
Oh, I see. Because their internal capacity for processing any additional stress is completely maxed out.
Exactly. So even a microscopic inconvenience causes a disproportionate reaction.
The sponge is so saturated that a single drop of water makes a mess on the floor.
That's a perfect way to put it. Then we see the temporal anxiety, specifically dread creeping in on Sunday evening.
The Sunday scaries, but worse.
Much worse. The weekend ceases to be restful because the biological anticipation of absorbing more trauma begins hours before the school week even starts.
Jeez.
The body starts releasing cortisol just thinking about the building, and that bleeds directly into severe sleep disruption after a difficult student incident. The trauma literally intrudes on their rest.
And what's the final symptom?
Well, perhaps the most damaging symptom to the school's ecosystem is that they begin slowly withdrawing from the very colleagues who used to be a source of energy for them.
Man, that is the most heartbreaking part to me. The very people whose deep empathy made them the pillars of the school community become entirely isolated because that same empathy is the vector for their injury.
Right.
They stop eating in the staff lounge. They stop chatting in the hallway. I mean, when the most emotionally intelligent adults in your building retreat into isolation, the entire culture of the school fractures.
The structural integrity fails. And leadership is often left wondering why the overall climate of the building has suddenly turned toxic, completely unaware that the invisible holders have collapsed.
Yeah, and the failure of those internal systems naturally forces us to look at how schools try to treat this.
Right.
Because if this is so common, aren't schools already doing things like, staff wellness days to fix it? You can't throw a rock without hitting a district that is promoting a wellness day or offering complimentary donuts on a Friday afternoon.
Yeah, the donuts.
But the source material is brutally direct about this approach.
It is. A one-off wellness day does absolutely nothing to treat a clinical injury like secondary traumatic stress.
Right.
In many cases, it actively generates resentment. Treating profound nervous system dysregulation with a yoga mat in the gymnasium feels deeply insulting to a professional carrying the weight of student trauma.
Oh, I bet.
What actually heals these holders requires foundational structural change. The sources outline 3 specific shifts, starting with workloads that actually account for this invisible emotional labor.
Meaning, if a specific teacher is known as the safe harbor for in-crisis kids, their schedule needs to reflect that reality. You can't just pile on standard administrative duties as if they aren't already doing 2 full-time jobs at once.
Exactly. The second mandate from the text is immediate debriefing after difficult incidents.
Okay, how does that work?
Well, think about most traditional school schedules. A teacher brings up a violent fight, or a counselor manages a student's self-harm disclosure, and 5 minutes later, the bell rings. They are expected to seamlessly teach a geography lesson to 30 new students while their adrenaline is still spiking. The sources argue we must stop moving straight to the next class period without allowing the adults to biologically regulate their own nervous systems.
Now, here's where it gets really interesting, because the third structural change the text demands is access to confidential counseling.
Right.
But it makes a massive defining point about the logistics of this access. Handing a staff member a generic 1-800 number for an employee assistance program is completely insufficient.
Oh, absolutely.
The sources specify that effective counseling cannot require a staff member to burn a hard-earned personal day. It cannot require them to sit in a public waiting room in the community where a student's parent might see them. And most importantly, it cannot require them to explain anything to anyone at the district level.
Because the logistics dictate the efficacy. The source material emphasizes that confidentiality isn't just a nice feature or a perk of a mental health program. Confidentiality is the entire mechanism.
Wow, if you don't have it, the whole thing falls apart before it even begins.
Exactly. Consider the internal power dynamics of a school district.
Okay.
If a front office staffer or a teacher even suspects that their leadership, the very people who conduct their performance evaluations, who dictate their salary, who decide on their contract renewals,
Yeah.
if they suspect they can see that they are seeking mental health care because they are overwhelmed, they simply will not use it.
Obviously.
The fear of being perceived as weak or incapable by their employer completely neutralizes the offering. Internal school systems inherently lack the distance required to foster that kind of bulletproof clinical trust.
And the internal fear of being judged by leadership is so strong, it forces us to look entirely outside the school building for a solution.
Yes.
Which perfectly transitions us into examining how external partnerships are stepping in to fill this exact void. Specifically looking at the second source we are analyzing today, which is the Operational Framework for MentalSpace School, which is currently deploying in K-12 schools down in Georgia.
Right. And if we connect this to the bigger picture, we have to look at the legislative timeline driving this shift.
Okay.
The urgency right now is immense because today is August 26, 2026, and the source material explicitly mentions that MentalSpace School is providing critical support for the HB 268 compliance deadline, which just hit last month in July 2026.
So districts are currently scrambling to figure out how to legally and operationally manage this.
Yeah, legislation like HB 268 puts massive pressure on schools to move beyond just talking about mental health awareness. They must have fully compliant operational systems in place right now.
Right.
They need care that satisfies IPAY, protecting medical privacy, while simultaneously satisfying FERPA, which protects student educational records.
Oh, wow.
Navigating the intersection of those 2 strict privacy laws is a logistical nightmare for a school principal.
I can't even imagine.
So MentalSpace School operates as a parallel structure, taking on the burden of compliance so the school can focus on education.
And the mechanics of how MentalSpace School actually executes this are fascinating because they directly solve the logistical hurdles we just discussed. They aren't just a random outsourced call center. According to the sources, they provide dedicated therapist teams per school.
That distinction changes the entire nature of the care.
How so?
Well, these aren't random practitioners entirely detached from the community. A dedicated team means the therapists actively learn and understand the specific, unique ecosystem of that particular school building.
Right, they get it.
They understand the culture, the leadership style, and the localized pressures of that specific district, which drastically accelerates the therapeutic process.
And to address that massive hurdle of burning a personal day just to get help, MentalSpace offers same-day teletherapy that is intentionally scheduled around the school day.
Which is huge.
Yeah. The accessibility is quite literally built into the reality of an educator's schedule. You don't have to write subplans. You don't have to drive across town in traffic.
Yeah.
A teacher can close their classroom door during a 45-minute planning period, regulate their nervous system with a licensed professional, and be ready for the next bell.
It's brilliant. And the scope of the framework is incredibly comprehensive. The sources state their services span across crisis intervention, suicide and violence prevention, the specific staff wellness we've been dissecting, and even family counseling.
That's a lot.
It is. Furthermore, they utilize licensed, diverse, and culturally competent therapists, ensuring that the care is resonant and accessible to the entire demographic spectrum of the school community.
Now, the element of this framework that really caught my attention was how they dismantled the financial barrier.
Yes.
Because we all know clinical therapy can be prohibitively expensive, even
Right.
with good insurance. But MentalSpace School has built a model where they've managed to get in-network with virtually every major commercial insurer in the state.
It's an impressive list.
Yeah, I was looking at it. It's massive. BCBS, Cigna, Aetna.
Humana?
Right. And then even Peach State, CareSource, and AmeriGroup. And most importantly, they brought the cost for Medicaid patients down to absolute zero.
Which is incredible because removing the financial friction is just as critical as ensuring confidentiality.
Yeah.
If a service is theoretically confidential but requires an out-of-pocket deductible that a paraprofessional simply cannot afford, it remains entirely useless to them.
It doesn't matter how confidential it is if you can't pay for it.
Exactly. By integrating ubiquitously across commercial networks and ensuring free Medicaid coverage, the solution becomes genuinely viable for the people doing the heaviest emotional lifting.
The theory is incredibly sound, but the data from the actual implementations is what proves the model really works. The sources highlight outcomes that frankly seem impossible until you understand the underlying mechanisms we've been talking about today.
Yeah, the numbers are wild.
They are seeing an 89% rate of improved attendance. How does 15 minutes of teletherapy drive systemic attendance up that dramatically?
It comes down to the biology of co-regulation. Improved attendance isn't just a metric of kids deciding to show up. When the adult in the room is emotionally regulated and supported, their nervous system signals safety to the entire classroom.
Oh, I see.
The ambient panic drops. Kids actually want to be in that environment. Simultaneously, the staff members stop utilizing sick days to avoid the psychological dread of an unmanageable environment.
Wow.
So the consistency stabilizes the entire building.
Which directly explains the second data point in the sources, a 92% reduction in anxiety across the board.
Yeah,
The ripple effect of one regulated adult regulating 30 kids at a time is just staggering.
it really is. And finally, an 85% rate of family satisfaction. When the school operates as a stable, regulated environment, that emotional stability radiates out of the building and into the homes of the community at the end of the day.
That makes total sense.
And the source notes that leadership trying to implement this kind of structural support can explore the framework at mentalspaceschool.com or reach out via mentalspaceschool@shanktherapy.com to understand the operational side.
So we've covered the massive institutional data, the legislative compliance, and these sweeping external partnerships. But I want to bring this all the way back down to a highly practical human level for the listener today.
Yeah.
Because the article provides a highly specific, actionable step that anyone in leadership can use this week, regardless of whether they have a massive external partnership up and running yet.
Yes, the source gives a very clear, immediate directive for closing the stress cycle.
After your next serious incident, whether that's a student crisis, a major conflict, or just a highly disruptive event, leadership must hold a 15-minute debrief specifically for the adults who are in the room.
And the parameters of this debrief are non-negotiable.
Right.
It must be strictly enforced that this is not a meeting about the student.
Right. It is not the time to fill out disciplinary paperwork or discuss the timeline of events or review a student's IEP.
Exactly.
Right.
It is purely a structural check on the adults. It is leadership actively stepping in and saying, I acknowledge the emotional weight you just absorbed. How is your nervous system processing it? And what do you need before you walk back into that hallway?
Wow.
It is the formal recognition of the invisible emotional labor. It closes the immediate biological stress loop so that the trauma doesn't calcify into the secondary traumatic stress we detailed earlier.
So what does this all mean? We started out looking at the clean, visible blueprint of a school, only to realize that the actual structural integrity is maintained by informal holders who were never officially designed to carry that weight.
Yeah.
We know the biological cost of that labor is breaking them, and we know that providing highly structured, completely confidential clinical grade support is the only way to reinforce those load-bearing walls.
Hmm.
But pulling all these threads together leaves me with one final, deeply complicated thought about the nature of this work.
Because this raises an important question about the intersection of formal systems and organic human connection.
Exactly. If the most effective, life-saving emotional support for students organically comes from informal, non-clinical staff, like the paraprofessional who has been there for a decade, or the front desk worker who feels like an aunt to every kid,
Right.
does the very act of formalizing their trauma support change the organic, casual nature of how they connect with those students?
That is the question.
If we step in and treat the front desk worker's emotional labor with intense clinical seriousness, does the front desk lose its informal, approachable magic, or does it finally become strong enough to last forever?